this is level. Okay.
You guys are live. Go ahead. The entire world is watching.
Oh, I can't hear her now.
Oh, hello everyone. Hi everyone. Hello Denise. Hi Deji in the background. Hello everyone. Thank you for joining today's Safe Space session. My name is Ifoma. I'm a marketing associate here at Virility Africa, and I'll be the host of today's Safe Space session. I'm so glad you chose to join us. I can see some people are already coming in. Our guest is also present here, and I cannot wait to introduce her. Hi, Denise. She's going to be talking about sexual health. She's going to be, giving us lowdown on how we can, manage sexual dysfunction. So I hope you guys are excited for the conversation today. Our guest's name is Dr. Denise. Hi, Denise. You want to go ahead and introduce yourself?
Yes, I'm Denise Asafu-Adjei. I'm a urologist, currently in Los Angeles, California. And I subspecialize actually in male sexual dysfunction and male infertility, but also deal quite a bit with, female sexual dysfunction as well, which comes across our doors as we deal with a lot of the male counterparts. So excited to talk today about various questions that people may have around sexual health and, really hopefully make it a safe space for both men and women to talk about what's on their minds around sexual health and dysfunction. So I'll give a kind of a preview about some general things that we see, and then hopefully that'll give some ideas for discussion points for people to engage in.
Wow, thank you so much. Thank you so much, Denise. You just mentioned that you mainly specialize in male sexual health. And I mean, today you're going to be talking to us mostly about female sexual health. And then also, for the guys that will be on the call, or for some of the guys that are already on the call, they will be getting some insight too. So yeah, thank you everyone. I can see that a few people have already joined in. So hi everyone, thank you for joining in. I would like you to briefly tell us your name. Please use the chat box, and when you use it, try to message all panelists and attendees so that we can have a conversation going in the chat box. So please tell us your names, what you do, and where you're chatting in from. You can also let us know what you're looking to learn from this session. That would be very helpful so that we can curate even better sessions for you. So please tell us your name. I'll be saying hi to you, just shouting you out a bit. So hi, Sally Pearl, where are you chatting in from? What do you do? It's so great to have you here. So please let us know your names, where you're chatting in from, so we can all know each other and have an engaging conversation with Denise today. So hi, Teresa. Hello, we also have people on YouTube streaming this session. It's so great to have you guys stream the session on YouTube. I hope that you're excited. Yeah, we have people on YouTube streaming the session. I hope that you're excited to be here, chatting with us about sexual dysfunction with Dr. Denise. Yeah, it's going to be an amazing conversation. So please put some comments in the live stream. Let us know that you're excited. Give a little happy dance. You can put a dance emoji if you're feeling it. So yeah. If you're feeling it, you can put a dance emoji, you can put whatever you like. But yeah, thank you so much for joining in on YouTube. So hi, Sally, you're a physician's assistant from Ghana. Welcome. Hi, Frances, you're a lawyer from Lagos. Welcome. Teresa, you're watching from Kisumu in Kenya. Wow, we have like global people here today.
Yeah, that's exciting.
This is a global conversation. So yeah, I'm so happy you guys are here. So thank you so much for joining. I'm going to go ahead and let our, special guest speak more about what she has come to educate us on today. So if you're listening in from YouTube and Zoom, anything insightful that you hear, please use the chat box to express yourself. You can, you can snap in the comments, you can put a period or two, whatever you're feeling. If you hear something that resonates with you, please use the chat box to, just let us know that you're feeling the conversation. So over to you, Denise. I'll leave you to talk to us and just,
Yeah. Well, I think this is great, just having this platform for people to talk about this. I think, unfortunately, sexual health, when we think about education and different things we learn about, it really gets the short end of the stick. And a lot of us, find ourselves in our 20s and 30s learning about a lot of things for the first time. And so I think it's great to just have these platforms where we're just getting some information about things to look out for, things to see a doctor about, and things that should pique your, potential concern or something that you may, want to address. And I think what's important about having these venues for both men and women are so that, if you are in a relationship and if you are looking, to solve some of these issues, maybe you've observed some of these things in your partner and, you think that maybe it's just you and they don't like you or something, but maybe it's actually more than that. And so I think, since our focus is going to be more on female sexual dysfunction, I'm going to really talk about kind of five big groups we think about with more common female sexual dysfunction issues. Unfortunately, with society and the world, everyone always thinks about sexual dysfunction with men and erectile dysfunction. Everyone hears about it, but there's so much more than erectile dysfunction, and so much more things that like matter. So I think this will be good, and again, hopefully, open to answering any questions and getting some dialogue going. So when we think about even the sexual cycle for women, we kind of think about it in being in four stages: arousal, kind of what we call a plateau, and then orgasm, which is kind of like the peak of, your sexual stimulation and, and everything, and then resolution. Think that as more women start to learn about, being empowered about orgasms and being empowered about these things, you can also start to take more control about, around your sexual experience and, what that means for you with whoever you're engaging in sexual activity, with, whether, male or female. So one common condition that we see is something called hypoactive sexual disorder. So it's basically either an acquired or like a lifelong lack of motivation for sexual activity. In a society now where with social media, things are so hypersexualized, right? And so it's just like you may be thinking, is it me? Do I not have enough of this, desire, whatever, what have you? And, sometimes there are hormonal issues around it in terms of what's influencing that, environmental issues as well. Right now we're in the middle of a pandemic. Not everyone's sex drive may exactly be at its peak, and there's so many different influences. So I think as a physician, when we are, trying to gauge this, we're really asking, one, is this something you've always experienced? Is this something that's a little newer? Trying to think around other environmental influences. Do you have a lot of stress at work? Did you have some recent big stressful life event that's that's influenced kind of your drive? Are you in a relationship? Are you not? Like, these are all things you want to think about. And also, I'm encouraging all the ladies out there to really pose these questions to your doctor. If you really feel like something is truly like bothering you and you feel like something is off, just talk to somebody about it. You don't really need to suffer in silence if you really feel like your sex drive may be markedly lower compared to what it used to be, or what you gather someone of your, your age cohort, where that should be. Sometimes it is a hormonal issue. There is one what we call kind of FDA. That's like the big organization based here in the States that kind of controls our drugs. There's like one medication that actually does address hypoactive sexual disorder. And when you compare that to all the things on the market for men, you just see even the biases in terms of how we treat sexual dysfunction. There's so many things to help guys with improving their libido. Libido is sex drive, but so many things, and that's just really not addressed as much when it comes to women. So I think it is one of the more common things we deal with. But my first start for you would be, talk with your doctor, make sure your hormones, your estrogen levels, make sure all of those are, kind of in line. The medication here that's approved is not as commonly used, but it is there specifically for this reason, AbbVie. So I think this is something that I do encourage people to address if you think that yours is truly, truly low. There is an off-label use of even testosterone for women that have low kind of sex drive and dealing with this condition, but it's off-label. But fortunately, not too many things to address it medically, but then also non-medical things, thinking about ways to to optimize you feeling happier and engaging with a partner who's supportive and someone you can work with. These are all things that will hopefully help to kick that funk of like a hypoactive sexual dysfunction. The second big category we deal with is something called female genital arousal disorder. And this is like the inability to kind of maintain or develop like an adequate response to sexual stimulation. This also has a variety of things associated with it. And women, as we get older, especially in our perimenopausal crowd, you're dealing with lower levels of estrogen, which then lead to, drive, kind of a drier vaginal lining. And that can actually just make sex, quite uncomfortable. And so, especially when we are finding women that are dealing with any kind of arousal disorder, we first, again, as I mentioned before, you want to think about what your other kind of environmental factors are that are maybe influencing your lack of response. But then also from kind of an anatomical standpoint, thinking about, is that dryness, is that making the experience overall and unable for you to kind of reach, that response. This is also something where, encouraging, women, young women, to take control about what makes you happy during a sexual encounter. So if you know what you like, if you're with a partner that respects and wants to actually help you, achieve that, this is also where having kind of good relationship dynamics really, comes into play so that you can actually achieve, your level of orgasm and, getting there. So I think it's really important here, if you have a partner, to really be having those open conversations about ways that you can really help to, optimize things. Dryness too, besides dealing with like, estrogen levels, lubricants are very widely available. So if that's something that, just being able to kind of feel things a little bit more, if you feel like that's something that would improve your response, there's various different kinds of lubricants. So you kind of want to see what your flavor is. I usually just caution younger couples that are trying to conceive, if you are going to use the lubricant, be careful and make sure that it doesn't have spermicides in it, which can kill sperm. But otherwise, there's water-based, there's oil-based lubricants, and silicone-based lubricants, and those all have different uses depending on, what you are, using them for. Some are a little bit more of that glide than others, but something that could be helpful. The third thing that women face in terms of kind of sexual dysfunction is something called persistent genital arousal disorder, and that's kind of persistent or constant feelings of constant arousal or, kind of intrusive feelings around like being interested in sex, wanting to have sex and things like that. And there isn't really a medication necessarily to think when, and persistent genital arousal disorder, I think we've been certainly diagnosing it more and more in the last several years as people think about, maybe why they're constantly a little stimulated. That's also something where, I think addressing that with your physician and thinking about ways that either from environmental standpoint, thinking about what triggers there are around those. Sexual therapists are actually really great when we're thinking about sexual dysfunction. I know that for a lot of people, doctors don't necessarily always want to push medications on you. Sometimes it's being multifactorial in your approach and thinking about, okay, if there is a true problem I can identify, that's one thing, but outside of that, what are other things I can do to either thinking about ways to maximize my relationship with my partner, make my partner understanding of this condition. So the persistent arousal, a little less common than the other ones, but something that we do see. And I think that when having a good sexual therapist and really thinking about how you can realize what your triggers are to maybe minimize that constant arousal, but again, having a good, hopefully supportive, partner and support system so that that doesn't feel too isolating for you. Female orgasmic disorder is kind of the fourth big thing, and that's a condition that also causes kind of distressing feelings around not being able to achieve orgasm, not being able to achieve it when you want to have it. And this, again, kind of comes into your relationship dynamics if you are in a partnership and trying to figure out what is going to help get you there. A lot of women think that something is wrong with them if they can't achieve orgasm during sex, and that's actually not a sexual dysfunction. When we kind of compare things that men and women need to kind of reach that orgasm, A lot more women need more on the kind of foreplay front when it comes to, helping them to reach there. So I think with that, it really comes to you, figuring out like what works best for you. And on top of the relationship dynamics, kind of going back to what we were talking about, what I mentioned before about kind of the genital arousal disorder, things like vaginal dryness, which is very real, really, really common. Vaginal dryness is not just influenced by estrogen, medications can cause it. Postpartum issues can cause it, after you have a child. And so you really want to be, thoughtful about how things are feeling down there and seeing how that is influencing your, your ability to reach orgasm. But I think this is really where women can continue to be empowered about what makes them happy and what is going to help them to reach orgasm. And that's all very individual, I would say. And then lastly, thinking about pain with sex, the term for that is called dyspareunia. Painful sex also has a variety of different causes. Again, sometimes different anatomical causes around vaginal dryness, around sometimes some parts of the labia and everything there could be some issues there. So you really want to have someone examine you. Dyspareunia, very uncomfortable. If you are experiencing any pain with sex, you really want to make sure you're seeing a gynecologist or someone who can really examine you and make sure there isn't an anatomical reason why you're having like painful sex. I would say there are certainly some surgical things that we identify that we can fix, but otherwise, things, again, going back to vaginal dryness and thinking about whether it's going to be, estrogen creams, lubricants, these are all things that can really help. And this is something where I would again incorporate your gynecologist to make sure that, depending on your family history and other things like that, you want to really have a discussion about estrogen, but lubricants are over the counter and you can really, help to see if that helps. But again, if there's an anatomical reason that's causing painful sex, you want to address that. There's also another condition we call vaginismus, which is basically like a spasm of the vagina that can also be quite prohibitive for women engaging in sex or anything, any kind of insertion there. So if you're experiencing this, just see your doctor. I think for a lot of this, I really try to encourage people don't suffer in silence and just at least rule out that there are other kind of organic causes that can be addressed before just chalking it up to being, psychological or, something else. But you really want to rule out those things first that can be, fixable. So those are kind of the big five, I would say, in terms of the big female, sexual dysfunction issues. With the male sexual dysfunction, erectile dysfunction is the most common, sexual dysfunction. But, and I think, as I mentioned before, unfortunately, society has probably focused a lot more on male sexual dysfunction. And everyone has heard of Viagra and Cialis, and again, a condition that I mostly treat, but I think it is really important to think about how more women can have a seat at the table when it comes to their sexual experiences and how they can be, better served. Sexual dysfunction in men, especially erectile dysfunction, is extremely common. Young guys can get it too. So I don't know for a lot of the people here on this call, if your partner is even in the 20s and 30s, we see guys that young that already have issues around, erections. And if you have a couple that in combination is experiencing different sexual dysfunctions, this is where open communication is very helpful so that both of you can kind of address things. So that's we got some questions.
I wanted to, something popped into my mind when you were talking about this, where like I've noticed that with men, their sexual related issues are taken more at like face value. Is normal, normal in the sense that they can talk about it. But with women, if you're facing like an issue where you don't get aroused, you don't even know how to bring it up because you're socialized to not bring up that. Like you're socialized to, you're not even supposed to feel that way as a woman until you're in your husband's house. There's that whole thing, especially with African women, where you're supposed to be sexually repressed until you get married. And then when you get married, automatically it's just supposed to open up and you know how to do everything. So how do you even know that you're going through something sexually, when you're in a culture where sexual conversations with women are not encouraged at all?
Yeah,
You know?
and that's a great point. But and I think it's hopefully avenues like this, now where people have more access to social media forums where women are also talking more about this. I mean, I think like you said, a decade ago, women would not dare say like I'm not being satisfied by my partner. That's blasphemy.
Yeah,
But unfortunately, it's a lot more common than we think. And I just think, hopefully, as more people are realizing that you have a right to also have an engaging and productive sexual encounter, just like men do. Hopefully, people will start to take heed and think more about this. I think you're absolutely right. I think society, especially in our African culture, we are not really kind of allowed to, be vocal
yeah,
about our feelings around
yeah,
sex. And I'm hoping conversations like this will change the
yeah.
tide so that women can
Because
be empowered.
I read a study where a woman was saying, like, some women were saying that they don't believe that the female orgasm exists because, like, I've been having sex for many years and I've never felt this and I've been having sex. So it's probably you're probably making this up, or it's something that doesn't exist, because there are still cultures where women don't believe that sex is for pleasure for them. It's not something pleasurable. It's just something that is done to them. And then if they want to have
Yeah.
kids, they have kids. So
Yeah.
even with that, when you already have that mental, perspective, and then the health issues, you can't even track if something is going on with you. I'm also thinking of a scenario where, say, someone has the opposite side where they get super aroused as a child and they don't understand what is going on with them. How do they manage, the social impact of that, being called a slut if they engage in sexual things? How do they manage that? How do they even go and seek help for that? But yeah, it's true. Like, we need to have more conversations, around that. First of all, like, awareness is very important for things like that. But as a doctor, like, what would you advise people? Like, what are the things they can look out for in themselves?
Yeah.
Because there should be, like, this thing can be a spectrum, right? So what are the things they
Yes.
should look out for to track that, okay, there's probably something wrong. It's not just that I feel this way, because these days I hear about people that are asexual. They don't feel like they don't have sexual desire for people. I hear about
Yes.
that. So how do you even know that there's something wrong? Because you're in yourself. If nobody tells you that there's something wrong, you may not know. So what are the
Right.
things they can do to ensure that they are in good sexual health generally?
Right. Well, I think even stepping back from the individual, I think society needs to do a better job putting this information out there. Sexual education, even in schools, elementary schools, high schools, it's really not widespread. I don't know, kind of the figures in the different African countries. I can only probably assume that people don't have for the most part, there isn't a lot of, great sexual education because it is such a cultural faux pas or a taboo to kind of talk about this. And even honestly, here in the United States, I mean, sexual education is really lacking for the most part. And so you're right, people get to a certain age, they don't really know what's normal, and I think as a physician, I'm more sensitized to it because this is kind of what I do. So I ask these questions. Most doctors don't ask about this either. You go to the doctor and it's just like, unless there's something kind of major, it's like cholesterol, diabetes, like these are the conditions that people are kind of bred to think more about. There's a lot of
Yeah,
people that don't ask about people's sexual function, so I think that's a
yeah,
global issue. And as a provider on
yeah,
this side, I think more of us are also trying to educate colleagues and other people that have access to the patients, that to the kind of people we're trying to reach. So when you think about, you're going through puberty, mostly kind of high school, end of middle school age. And so if you know that that's where most people are going to have that shift in how they're looking at their bodies, how they're feeling about themselves, people of the opposite sex or what have you, that's really when you need to start educating people about what is
yeah,
normal and what's not, and
yeah,
I think we have
yeah,
more work to do there. For the individuals here, I would say anything that is bothering you is worth addressing. So I think that
yeah,
a lot of people, whether it's like, oh, I don't like going to the doctor or whatever, and not even saying that the doctor may have all the answers, because as I mentioned, a lot of people are not even comfortable addressing this in a doctor's visit. A lot of what I talked about, even around, the different kinds of female sexual dysfunctions, there's even a lot of gynecologists who don't really address it, right? You go, you do
yeah,
your pap smear, you do whatever, it's not really addressed. So I think anything that is potentially bothering you is worth addressing. And I think sometimes these
yeah,
dynamics don't come out until you have a partner, until you're engaging in sexual activity. and then you say,
Yeah.
oh, I think this may be off. One thing I do want to caution people against, though, and I think this is like probably a whole other topic, but now that there's so much access to pornography, people also have a very tainted view of what that sexual experience is like. And
Mm.
so, if that happens to come across your door, I mean, just know that 99% of the world is not having sex like what you see in a porn. And so I think that also kind of falsely shifts people's expectation to be
Of
like, I should be
what sex
doing
would be
this.
like for them.
Exactly, exactly. And this probably more so around, men,
And then it
who
puts expectations on both sexes. Yeah, it puts
exactly,
like an unrealistic expectation on both sexes on what to expect when they are meeting the other person. So they are meeting
right,
a version of you that should be able to do all these tricks that they see, not the version that just comes as they are and is trying to learn and experiment. Yeah, because it's
exactly,
also the thing where a lot of women claim that they don't have orgasms, but then men say that they give their women orgasms. So who are we to believe? So most times there's also the culture around like you watch porn, the girl is screaming. So you think when you're having sex, you should be screaming, whether you're enjoying it or not. That should be the normal thing
exactly,
for you. And then it keeps on
exactly.
going on and on. Yeah. So
Yes.
a few people are asking some questions. So I'm just going to start asking. Someone said, apart from dryness, what are other common things that women face postpartum? Yeah. So apart from dryness, what are some things that women also face sexually postpartum?
Yeah, so besides dryness, potential pain secondary to that. So, pain with sex secondary to, dryness, depending on, how your delivery went, whether you had any kind of extra stitches or sutures down there,
Complications.
what have you, that may influence things. Body image is really big. After you have a child, how you feel about yourself is also going to influence how you engage with your partner. So sometimes feelings around avoidant behaviors with sexual activity because you don't feel like yourself. I'd say those are the most common things that that we see. And as your kind of postpartum, as your hormones start to level out, so to speak, and as your body kind of goes back to your baseline, hopefully those things keep getting better and better. But I think
Mm,
this really again speaks to having a good supportive partner who's being really, supportive and helpful as you're going through this transition. But I'd say the top three things would be vaginal dryness, which can be, mitigated with lubricants. And then, sometimes secondary to that, some pain with sex from dryness. But I think really the body image is a big thing that we see in our postpartum women and just wanting to engage,
yeah.
in sex at all.
Yeah. So someone else asks, does having no intention for sex for a long time, can having no intention for sex for a long time be termed as a sexual dysfunction? I think you kind of covered that, but like I think they want to know, like what I wouldn't ask is what is a long time? So if you're celibate for a year and you're really not feeling anybody, is that a problem? Does it get to a problem when it's 2 years or 5 years? Like where can we draw the line and say, okay, this is a problem?
Yeah. So there isn't like a timeline, when we talk about like hypoactive, sexual dysfunction, there isn't like a set timeline kind of in the definition of it. And I think, going back to things that like bother you, there's nothing wrong with not having an interest in, having sex. But I think if it gets to a point where it's bothering you and or, a partner you may have, then that may be something you may want to address. If you feel like it's something that's changed, like if you knew that 5 years ago, you were someone who really liked having a lot of sex and it's very different now, that speaks more to, what's changed, and let's kind of target what that shift is. But there isn't, especially from a medical standpoint, there are some people, like everyone's different, right? And so not everyone, there's some people do have just like a baseline lower, kind of desire or appetite, so to speak, for
Yeah.
sex. And that is okay. I think when it gets to be bothersome to you, where you're actively thinking like, maybe I want to have a higher drive, but I genuinely don't, I think that's when you want to address it. But if you're content, if you're with a partner who maybe also doesn't really like engaging that much, great, perfect matchup. But I think there isn't like a timeline around where you should be, concerned. And I'm certainly not advocating for, again, everyone's different. If you like having a lot of sex, that's great. If you don't like having a lot of sex, that's great too.
Yeah, that's
Yeah.
insightful. Someone says, does masturbation affect your libido?
Does masturbation affect your
affect your libido, your sex drive?
Libido, oh, your sex drive. So I think, masturbation can be helpful in that, especially as you're exploring your bodies, you can kind of figure out what works for you. And I think this also speaks to kind of empowering yourselves around like, I know this is what I want. I know this is what's going to help me to more orgasm. So I think masturbation is actually, good, and that, it can kind of help you to see what your triggers are so that, when you do have a partner, you can guide them a little bit. And I think that actually kind of helps with both of you really maximizing, your sexual experience. I think if you have a partner and you masturbate at the expense of not wanting someone else, I think that can influence your desire to engage with someone. So I think there is a balance. Masturbation is, will kind of help you to figure out what works for you. But if you have a partner, ideally, you would want them to be helping you kind of achieve that. But if you find yourself doing it more and more by yourself, or you're like, I don't need you, I mean, you could do that too, but if you actually want your partner to engage, it's probably better to incorporate them in that process. So
okay,
it doesn't.
so how much?
Mm-hmm.
Yeah, you can go on. I was going to ask, like, how much is too much? Like, how much is too much masturbation? Like, when does it get to the point that it's just like, no, this is out of hand? Is it different for everybody?
Yeah. So I think with with masturbation, again, there really isn't like a timeline around what's considered excess, what's considered bad. But I think, if you are masturbating and missing work, if you are masturbating and, missing your child's play, I mean, I think if it's actually getting in the way of your day-to-day activities, that's excessive. I think if you have all the time in the world and you can do it, great. But I think most times people would see that as a problem if it's actually interfering with day-to-day activities that you have to do, like work. And if it's interfering with relationships, if you have a partner who wants to get it on with you and you're masturbating, then that's, probably excessive. I think also if you find that you're having physical signs of excess masturbation, like almost like not rug burn, but kind of almost like friction and things on the skin, then you may want to hold off a little bit until you're a little bit more healed. But I think those are more signs that, maybe your body can't take that frequency. But yeah, there unfortunately isn't like a number. So I would just caution people, if you feel like it's getting in the way, if you're missing activities and things like that, you should probably back down a little.
But like, I want to ask a question. This is out of curiosity. Is masturbation a normal thing for human beings to do, or is just something that we do because we discovered it? Is it like a primal thing for us? Is it normal to masturbate from time to time?
So I think this is also very subjective. I think that, as you go through puberty, as your hormones change, I think you do have a higher curiosity about, same sex, opposite sex. And I think, your sexual curiosity, changes, as you get older, particularly during puberty. And so I think that process is natural where, you are a little bit more sexualized, or you're thinking about this a lot more, your hormones, right? Change around puberty. I think the actual act of masturbation, it's, seeing it as like natural, or, something where everyone has to do. No, everyone doesn't have to, masturbate by far, but I do think that curiosity around, pleasure, that's something that definitely changes with, puberty, and as, your hormones kind of change. And so I think you certainly shouldn't feel like you're abnormal if you're not masturbating by far. But everyone, regardless of how you feel, you're going to have changes around, sex and pleasure, just because of, just by virtue of your hormones changing with, puberty and getting a little older.
Okay, thank you so much for that.
Great question.
Yeah, because there are two sides to it. Some people are like, okay, I'm religious. My religion does not, make me subscribe to this. I'm trying to not do this because of my religion, and they still struggle with that, So it might be a thing of, okay, I'm struggling with this thing. I want to stop it, but it seems like I can't. So in that case, is this something that is just like, you're more like humanly predisposed to do that, whether or not you try your hardest?
Yeah.
Especially if you have a partner.
Yeah, I mean, I think that this is, again, where I think education is important, because I don't think, everyone, your sexual curiosity manifests in different ways. In a lot of people, it may manifest in the way of masturbation, but other people not so much. So I think having these conversations to normalize, like, hey, if this is how, your curiosity and your pleasure spectrum, if it ends up in masturbating, fine, like that's normal, but it's also normal for it to manifest in different ways. I think, culturally, and religiously, I mean, growing up myself, like in the church, this was not something that was talked about or, was really put out there. But, you go to school, you're around other people, it's there, So I think, unfortunately, it's not something you can completely avoid, but I think it's just important to, get out there. It's okay to be on both sides of the coin. It doesn't make you abnormal for not wanting to masturbate. It's okay. But I think everyone is going to go through those changes around how they feel about their bodies and other people's bodies.
All right, thank you so much. Someone asks, is there a way to get a virality test without actually having sex for the men and the women?
Is there a way to get a viral test?
Is there a way to get a virality test without actually having sex for the men and women? That's the question.
Okay.
So I don't, yeah.
Virality, I mean, you could always get an sexually transmitted disease panel where they can test for things. I think that's certainly something that you could do. Even if you don't have a partner, you probably don't have much there if you're not actually engaging. With women, there's a few more vaginal conditions that are not exactly sexually transmitted diseases per se, but women get your yeast infections, vaginosis, and other things. And those are things that I would say, if there's anything off, checking with your doctor or checking with your gynecologist in the cases of women to make sure everything's okay. But you can always get the different kinds of sexually transmitted diseases or any viruses you want to test for. They're either the form of a blood test or a urine test. So I would just ask your doctor if you're curious.
Okay, so I think the person is asking about virility tests. So more towards the sexual, not the like bacterial. So like like how agile they are sexually. So is there a way you can know how sexually agile you are without actually having sex?
Okay. I see. Yeah, no, not really. Because there isn't a benchmark. Yeah. There isn't like a benchmark for it. I mean, I think when you're thinking if you're looking at it from a purely hormonal standpoint, yes, you can look at your estrogen or your, like, in the case of women, or testosterone levels in the cases of men. You can look at those levels and just make sure you're within normal range, because we do know that when those levels are below the normal range, then you're on kind of the hypoactive side or the lower sex drive side. But there isn't something that'll say, above this amount, you are hypersexual or something like that. There are guys, for example, that have naturally high levels of testosterone. They're not necessarily particularly higher, sexually than like a guy whose testosterone may be on the lower end of that range. So I think usually in terms of testing, and testing those hormones, it's usually on the side of, people that are, having like lower sex drive, just to see if they're within normal range. But if you're in the high end of that, there really isn't a great test to say above this amount, you're like hypersexual or something.
Okay, someone asked, yeah, you did. You actually did. So someone asked this question in a very interesting way, and I'm going to read it. The person says, my heart becomes soft when I am inside my lady. Is this considered erectile dysfunction?
Yes, it is. And I think that, with that, we would really want to tease out, how long that's been going on for, how quickly that's coming on. I think also piggybacking off of the conversation around pornography, guys are out here thinking that, they need to be lasting like an hour. Like that's just not, true. It's like actually the average is, closer on the order of like 5 to 10 minutes for most guys. And so I think if you're someone who you had a relative change where you went from, I don't know, 40 minutes to 30 minutes, and you're just like, I'm not lasting as long, you're probably not going to get a lot of sympathy from most people, because most guys aren't lasting that long. But I think if it's something new, it's certainly worth exploring, especially if you are in the age range where you're trying to have a child, you're not really achieving orgasm, you're not kind of flowing through the sexual cycle the same. And but there's fairly easy ways to deal with that. There's a fairly easy to access numbing cream or numbing cream that you can put around the tip of your penis that will help to diminish that sensation. So the end of your penis, the glands, is the most sensitive part of a guy's penis. And so if you are having sex, that may be a little hypersensitive. So there are topical things that can just help to diminish it a little bit, not fully take the sensation away, but just so that you can get a little bit more time out of your sexual encounter. But yes, that is considered a dysfunction, but there's a lot of very easy ways to address that. So if that is an issue, I would again talk with your doctor. And that's more along the lines of like premature ejaculation is really the big umbrella term for that, but there's a lot of easy interventions for it.
So I want to ask you a question that is not really medically related, but is related to sexual health. Like, how do you manage a relationship where you're not sexually satisfied? How do you communicate that? How do you navigate that in a sense? How do you tell your partner, like, you're not, because it can be an ego thing, right? You're not sexually satisfying me. How do you bring that up, and how do you make your relationship like sexually healthy in that sense?
Yeah. And I think, most people are not comfortable getting feedback in general, especially when it relates to, your feelings after sex. Like nobody wants to hear that their partner isn't fully, satisfied. But I think if you are with a good partner, hopefully their goal for both of you is to be, satisfied. And I think, everyone's different. It takes time to be really that open with people. But I do find that hiding it from your partner is certainly not going to help. And so even though it may be uncomfortable, you may have to just bite that bullet and have the conversation. If you find it really difficult, there are more and more kind of the presence of sexual therapists that I think are really underutilized in a lot of couples, and I think can really help to bridge that communication gap and to help couples kind of achieve, get to the point where they want to be. And I recognize that's not available everywhere, but now luckily with social media and Zoom, a lot more of these therapists are actually available online. If you can, if you kind of search and, if you shoot me a message, happy to send some names your way. But you could do a lot of this virtually now, where you can have the conversation and, really help a third party to help you figure that out. So if it seems too daunting to do on your own, there are specialists that deal with this. And so you certainly don't have to suffer in silence. But I think it goes back to a little bit more fundamentals in regards to communicating with your partner. And even though it's uncomfortable, being satisfied sexually should not be off the table for conversation.
Okay, great. So someone says, how do I manage pain during sex in specific positions? So I'm imagining when they're in certain positions, they don't feel pain, but when they're in other positions, they feel pain. So how do they manage that?
Yeah, I mean, I think that's also is a little subjective. If you were having pain in all positions, it could represent either an anatomical cause of pain or, some issues around dryness. And also not even just focusing on like dryness or vaginal issues. Sometimes there's penile conditions that also can, cause pain. Guys can develop changes in the shape of their penis as well, and that can also, cause some discomfort. So if you guys are experiencing new discomfort, I would actually encourage you to, kind of double check and make sure that you, as women, like you feel maximally lubricated, but also for the guy to make sure that you're looking at any changes in the shape of your penis or anything like curves or bends anywhere. That could also make the sexual encounter more, more painful. And those are things that are worth addressing. But if everything kind of anatomically looks normal, you may just have to maximize on positions that are, not as that are more comfortable. Yeah.
Yeah. So is change in penile shape and size a cause for concern at a certain age? Say you're like a grown man, you're 25, 26, and your penis is changing in shape or in size. Is that a cause for alarm?
Yes, it is. So there actually is, a condition that's called Peyronie's disease that is a sudden change in the shape of the penis. And actually, it's characteristically noted by like a curve or a bend in the penis. Like if you think of like a banana, some guys may just suddenly develop that. And then most guys, it either can come on after some trauma, intense, vigorous sexual encounters, or just comes on kind of randomly without any clear cause. But if you do have a sudden change in the shape or direction of your penis, that is definitely a cause for concern, because there's actually a condition that causes that can be, addressed. As you get older, the penile tissue, does start to not get, it's not going to be as robust as it was when you were 15. I don't expect that to happen to like a 20 or 30 something year old. But, if you have other bad comorbidities, like, your diabetes, hypertension, those all affect the blood vessels that lead to this, or, that lead to the penis. And so if you take really bad care of yourself, quite honestly, you're going to accelerate the process of, not having your penis stretch as well, not having as great erections, but then also that's going to result in secondary kind of, shrinkage, or, kind of a smaller appearance. Obesity in men as well. If you have like a really big belly, that also is going to decrease the size of your penis, because basically your penis is like shrinking in or involuting into your abdomen. So people be like, oh, I noticed a length loss, and it's like you have to actually like lose weight and lose the beer or fufu belly. But that's something that also can, change things. So I just always encourage guys, maintaining a good healthy lifestyle, exercising, eating well, really pays dividends down the line. But yeah, any sudden change in like the shape or direction of your penis is definitely a condition as a urologist that we treat really commonly. So I would not suffer in silence with that.
Okay, thank you so much. Because I know there are some guys here, and I just want to make sure I'm addressing some questions they may have. So someone says about half a year ago, I started feeling severe pain whenever I have sex with my boyfriend. It usually disappears after some minutes, but it happens every time. So since like past 6 months, every time she has sex, she feels pain, but it disappears after some minutes. So.
Okay.
And
So,
so she follows up. She says, we already tried lube and I went to my gynecologist, but he couldn't find anything unusual. Do you have any idea what could be the cause?
Yeah, that's I mean, of course it's, tough to say without, looking there, but I think, the advantages of an exam are to really focus on the areas that may be, and maybe you have like a point area that is irritated when you have sex. I mean, I think it was great for you to start with lube, because that at least will help, reducing the friction a little bit. But if they, did a full exam and didn't find anything, I just wonder, sometimes nerve related issues too. If, either with the labia in particular, sometimes those areas can be either a little denuded or, again, just look a little raw. And so that sensation is a little bit, off for people. So I think if it's still bothering you, I'd have to know your location, but I think probably a deeper dive would benefit if none of those are helping. Sometimes there are nerve related issues that if you really have people to specialize in this, they can, really address, so you're not as, kind of exposed. But, I think it was great that you started off with a lubricant and getting a general exam, but it sounds like that may require a deeper dive and, or, potentially imaging or something to see if it's not something directly in your vaginal canals or something outside that's impinging on it somehow that's causing that pain. So I think it sounds like you need a little bit more of a deeper dive into that, with looking at some adjacent anatomical structures to see if that may be the cause.
Thank you so much. I hope you guys are taking notes on YouTube, on Zoom. I hope you're taking notes. I hope you're learning a lot from this session, because I'm hearing things I've never heard before, and I'm just like, wow, this is free. So yeah, this is like a consultation for many people, for all of us on the call. So I'm so glad to be learning this stuff. So someone says, is it considered sexual dysfunction when the woman climaxes really quickly every time during sex? I mean, before the man. How do you control that or stop that?
No, I mean, and especially around like orgasms, I think men tend to be a little bit more aware of this so that, they're lasting long, that they're lasting long for their partners. Most people, are not complaining about having too many orgasms. So I'd probably tell you to, your partner's probably doing a good job if you're getting it pretty early. If you really want to prolong and like wait, I'm not sure if this person, if you're engaging in a lot of foreplay, by the time you actually get to penetrative sex, you may already be almost there, which is why you're orgasming so quickly. So I think it may be a balance with either decreasing some of that foreplay so that you can orgasm a little bit later, or just having more orgasms. If your partner's getting you there, have one at the beginning and have one again.
Great. So, is it a myth that certain women can only orgasm through, finger play and what they call this now? It just skipped my mind. And through I've forgotten. I want to say the word, but I don't want to say through like getting head and finger play, and some women can only orgasm through penetrative sex. Like, is it a myth or is it a true thing that some women may never orgasm through penetrative sex, while some will only orgasm through like extra being their clitoris being stimulated and stuff?
Yeah. So, anatomically, the clitoris is very similar to the tip of, a guy's penis, meaning those are the two areas where sensation is really maximal. Everyone is truly different. And so, with women, the clitoris, if you're stimulating it prior to sex, with, it just depends on really what works for you. But I do think it's not a myth. I mean, I think there are some people, their bodies, that's just what it is, that's what they like, and that's how they orgasm. I think if you want to shift things a little bit and say, hey, maybe I orgasm a little bit more easily with with oral sex, and I want to actually be orgasming through penetrative sex. We know that women generally need a little bit more in terms of foreplay to kind of get them there. And so I think that that's when you want to just think about your kind of whole sexual experience, timing of things. But I don't think, again, it's not a problem, if you and your partner, if you're still having
Yeah.
orgasms, like that's great. But if you're specifically trying to target having them in the setting of sex, I think you do have to be really intentional about, with women, that clitoral stimulation. And I think, unfortunately, if we are talking about a man and a woman having sex, a lot of the focus tends to be on kind of guy's pleasure, guy's sensation, and I think the clitoris is usually left blowing in the wind. But I think ways to get around that are, more foreplay, being more intentional about stimulating it during sex as well would, I think, help get around that. But nothing wrong if there's other things that you like that helps, get you there.
So we have a lot of questions, so I'm going to like throw them rapidly at you. Someone says, what could be the cause of bloody discharge during sex? And then she also asks, how does female genital mutilation affect a woman's sex drive?
Yeah, good question. So, bloody discharge, during sex, definitely something that you would, want to address. Again, that could be anatomically something that's there, somewhere in your vaginal canal that, with penetrative sex, it's being irritated, and that's causing blood. Again, it could also be that things may be a little too dry. If you think about having like rug burn, if you're having sex and things are too dry, the lining of your vagina actually may be irritated, also causing, bloody discharge. Depending on your age and your family history, you also want to be thinking about, if this is pretty consistent, you definitely want to see your gynecologist and make sure you're not missing anything around cancers and, other kind of non-sexual related things if you're having a lot of bloody discharge. So I think, for those of us here, have your regular pap smears and make sure you're always getting checked. But if it's really, excessive, and that's something I would definitely see someone sooner rather than later to rule out all the bad stuff. And kind of once that's ruled out, thinking about, okay, am I too dry? or is there something in there? And your gynecologist should be able to find that out with an exam or through imaging. With female genital mutilation, that's generally basically taking off or, destroying the clitoris essentially. And it's unfortunate because, I mean, that's essentially cutting off any bridge to you having any kind of sexual pleasure, since the clitoris is kind of where all these nerves and everything really coalesce for you to have that maximal sensation. So, I think now with a lot more awareness and activism for it, that's become, certainly less compared to 20 years ago. I know it still occurs in a lot of parts of the world, unfortunately. And I think this speaks more to advocacy for sexual health for women. No one is walking around cutting off the tips of guys' penises, so no one should be doing that to us essentially. So quite unfortunate, but I think unfortunately that can really diminish that sexual pleasure, but doesn't mean that that's not the only. You have different sexual organs, so besides the clitoris, even though that tends to be the focus, you have a lot of other ways that you can achieve pleasure during sex. And so I think if you are someone who's experienced that here, again, if you have a good supportive partner and you guys are learning each other's bodies, you can certainly still have orgasms. You can certainly still have a very happy, productive sex life, even if your clitoris is out of the picture.
Yeah, so I have a question. How does depression affect your sexual drive and your sexual health?
Yeah. Well, depression plays a huge role in that. I mean, in general, when you're depressed, you have a kind of a global lack of interest in things. And so there is a lot of overlap with that and kind of the hypoactive sexual disorder that we talked about. But depression, very common, but something very serious that you want to pay attention to. But it definitely contributes to your interest in sex. And so I think if you have been diagnosed, or if you know that you're going through clinical depression, it's really important to address that first, because you'll probably find that once that's resolved, and once you've addressed that, all of the other issues around lack of interest in other things, they're probably going to resolve. If you feel like, hey, I'm not really feeling depressed anymore, and it's specifically around sex, then I think that's something that you can, take a deeper dive with. But yeah, certainly if you're depressed in general, sex is probably not going to be, it's not going to be anything that's going to be different in terms of things that you're finding interest in.
Okay. Someone says, is it when a lady doesn't get orgasms or wet during sex, is there a problem with her?
I don't think it's a problem with her. I think it's just maybe navigating what's really what's giving her pleasure, and what's allowing her to actually get more aroused. So I think if you find that you're not there, I think this is when you think about, if you have a partner, how can you maximize ways to get get yourself more aroused, which will then lead to more of that natural lubrication. But I don't think it means there's something wrong with you. I think it just means that we haven't really figured out what it kind of what gets you going. So I think in that case, I would really, if you're single, work with yourself and explore your own body to figure out, kind of what makes you tick. If you have a partner, let them help you. But I think it just means you probably have some more exploring to do around, what your body needs.
Someone says, and this question is directed to you, the doctor. As a person within the medical field, what age do you think is appropriate for a person to begin to engage in sexual activity? I know there isn't a specific age, but maybe a range. So
Okay, and I know people hate this question, but it's subjective. I mean, there really is not an age that anyone should be doing anything. I mean, you have some people that are, waiting until marriage before they engage in asexual activity. You have people that have been exposed a little early. I mean, I don't think there truly isn't like an age. I mean, I think there are some people that are late bloomers when it comes to engaging in sexual activity. Some people a little early, but the bell curve is really, really wide. I certainly don't think, a 10-year-old should be engaging in, in anything, but, I think really, once you hit puberty, again, your body is changing, your hormones are changing, your feelings are changing. So I think that desire is certainly going to be there, but no one should feel any pressure that by a certain age, if they haven't done anything, that there is something wrong with them. There's nothing wrong with you if you haven't had, sex until your 20s or 30s, like, that's totally fine. It's personal, it's very individual, and it's a very unique experience, and that shouldn't be, rushed by societal, benchmarks. That really should be a decision you're making for yourself.
Great answer. So someone asks this question, and it may not sound, but well, I feel like to you as a doctor, you get all kinds of questions, so nothing can surprise you. I don't think it's a weird question, but a lot of people on here might think it's weird. She says, how can a lady know that she has experienced an orgasm? Are there specific signs or things that happen for you to know that you are there?
Yeah.
So essentially, what does it feel like?
Yeah, I mean, it's, of course, very hard to, describe, but I mean, orgasm is an extremely intense sensation of pleasure. And I think that, that is coupled by, lots of, kind of concentrated, lubrication and kind of a sudden, kind of rush from a feeling, emotional standpoint, but also like physiologically, evidence that you are getting kind of a concentrated instance of moisture or lubrication down there. But I can't really tell you how to feel, but it certainly feels different. But it's a really intense moment of pleasure and sensation, and your body also has and kind of a physical manifestation of that. And so I think you're right. And then some people don't know how they should feel or like what it is, but it's a very distinct feeling. And I think it's, again, this is such a hard topic to talk about because, again, everyone's a little different, and it's just like, I don't know what your benchmark for intense pleasure is or how you feel that, but if you are really being kind of maximally aroused and you kind of get there, it's almost like a cascade that happens. So I can't really explain how you should feel, but it's different.
Wow, it doesn't seem like we have spent time because we've just been talking and listening to answers and learning a lot. We have to go soon because we're a little over the time. But I'm going to ask this last question. Someone says, what could be the cause of breast discharging milk during sex? And I want to assume this person is not breastfeeding or pregnant. So
yeah, it's certainly if you have spontaneous milk coming from, your nipples, you should see your doctor because that is not normal, especially if you're not lactating or doing anything else. So yeah, if you have any kind of nipple discharge, I would actually be concerned that you either have some kind of growth or something in your breast that needs addressing, or some other, which could be either be breast cancer or some hormonal imbalance. There's one hormone that really gets a lot higher when you're pregnant and breastfeeding that causes, that milk causes you to lactate. There could be something there, that's causing that particular hormone to go up. But in women, I would be really concerned about new nipple discharge being a sign of breast cancer. So if you have that, you should definitely be going to see your doctor as soon as possible.
Okay, so I said that was my last question, but I lied. I lied because I remembered another question to ask. This is something that a lot of women go through. I personally also experience it with menstrual cramps. When do you feel like the menstrual cramps are unbearable? What is unbearable? I know you say everybody is different and our bodies feel differently, but when should it be a cause for concern? Like, with menstrual cramps?
Yeah. So, if you can't function, or if, your cramps are actually getting in the way of, daily activities like work, home activities, going to places and, other things, that's a cause for concern. Cramps are generally painful, but if they are, if you're getting admitted to the hospital for, refractory pain, secondary to cramps and other things, you want to address it. I mean, some people do just have painful cramps, but it could be a sign of, again, something else. And we know that, fibroids are really common, especially in Black women. So I'd say for most of the people on this platform, if that is coupled with, really excessive bleeding, really bad cramps, I mean, you just want to make sure you loop your gynecologist in there just to see, what may be going on. But your cramps generally should not be taking you down for the count. They
Hmm.
can, but again, gynecologists are great about figuring out ways to navigate around that, whether it's in the form of birth control, which can help regulate your hormones a little bit so that that process isn't too intense for you, or that you may not experience it, so you can avoid it altogether. But I would loop in your gynecologist. But
Hmm.
certainly if anything excessive, I really think about how does it get in the way of your day-to-day activities. And if you really find that you are, canceling things and, things are totally off the table, that's something where you really want to address it. Your life shouldn't be put on hold because of your period.
Okay. All right. Thank you so much. There's something. Okay, I was going to ask you something, and then it just keeps my mind immediately finished talking. Okay, yes, I remember. Can someone like regulate their hormones through dietary changes and lifestyle changes? And what are some of the things that they can do? Or do you have to go on birth control to regulate? Because some people have like side effects from going on birth control that either compound the issue or make things. So are there things that they can do holistically in terms of their diet and their
Yeah.
lifestyle that can help regulate your hormones? And what are those things?
Yeah. So, I mean, there's certainly things. So I would say like in the way of estrogen, for example, there's something called phytoestrogens, which are kind of naturally occurring plant compounds. They're structurally similar to estrogen. And so when people talk about a lot of like foods that are like really good to help keep yourself regulated, they're not going to shoot your estrogen levels up, but they will fool your body into thinking you have, like more estrogen, and will have those secondary effects with like, moisture and things like that. Some of the big categories are like soybeans or soy products. Avocados also are, are really high in these things. Green leafy vegetables as well. But phytoestrogen specifically are found in a lot of like plants and diet foods. But and a lot of our, I'd say a lot of African foods, garlic, parsley, you could find them in like legumes, but they're weaker than regular estrogens. But if you just look up phytoestrogens and look at foods for those, I'd say soy products are like the really big categories, but there are ways that you can naturally kind of get in your diet. There aren't any great ways to generally regulate the rest of your hormones. And I usually just tell people, having good health and sleep habits really go a long way. And this is also for the guys with their testosterone levels. There isn't a great natural way to boost it. But if you're sleeping regularly, we know that poor sleep does result in your hormone production being off. And so if you're sleeping regularly, that will at least ensure that your hormones are, being produced in a kind of a regular or normal, manner. But if you're not sleeping regularly, you're not taking care of yourself, it just throws that process out of whack. So I think the best natural thing you can do for yourself is to make sure you're getting, 6 to 8 hours of sleep a night, trying to have as healthy of a diet as possible. But at least for the estrogen, there are some foods, like I mentioned, the phytoestrogens, that can help a little bit, but they're not going to completely be game changers if you have like truly super low levels of estrogen. But they can certainly help if you're trying to look for other
Yeah.
ways to kind of keep those levels up there. But just good sleep, good eating habits.
Okay, thank you so much. So someone says, and this question has come repeatedly, so I'm waiting to ask. Someone says, I think I have HPV. Should I be scared?
I mean, I think you should, one, diagnose it with your, have a gynecologist, figure out what strains you have. There are some that are more aggressive than others, but there are treatment protocols for managing HPV around monitoring you with pap smears and other things. So I think that's something you want to talk with your doctor about and just see what strains you have, because that's going to dictate the follow-up and, the care. Now, actually, I think they extended, there's a vaccine for HPV, and I think they actually just increased the age limit to like 42 recently, I was reading. And so if you haven't had HPV yet and you have access to the vaccine, that may also be something that you may want to explore so that you actually have some protection against it.
How common is it as a condition? Like, is it fairly common?
HPV is pretty common. I don't know the percentages offhand, but common enough where at least now we have a vaccine for it. But there are some strains that are not associated with linking you to cervical cancer, and others are. So that's why it's important to kind of know which one you're dealing with, so you kind of know how to monitor accordingly.
Wow,
And
thank you so much. Thank
No
you so much. This
problem.
conversation has been, I feel like we should host another one because more people need to know. I just feel like we should have another one because we need to have these conversations. They're very important. So thank you so much for joining. Thank you everyone that joined in, for asking your questions openly, for not
Yeah.
for not holding back. The questions were really surprising and insightful, and they, we went into so much in this short time. So thank you everyone watching on YouTube. I'm sure you guys are having fun over there. Thank you for those watching on Zoom. I just want to mention that you can find Dr. Denise. Where can they find you? Because I want them to find you. So yeah, pop in your socials.
Well, thank you so much for having me. I think this platform is great. So if you, as you mentioned before, if you're not subscribed to She Leads Africa, please subscribe, and hopefully it'd be happy for us to think about something else in the future to talk more about some sexual health fun stuff. And then I'm on Instagram, Denise DNISE_DDOC, Denise D Doc. So you can find me there, and I usually like to post some fun things around information and things. So you can find me there. But thank you so much for having me. I think again, we need more platforms like this, especially for women, to be thinking about, and just empowering us more around our sexual health. So thank you for giving us the platform as well. She Leads
Thank you
Africa.
for coming on. This was amazing. If you do not follow us on YouTube, please follow our YouTube channel. We have so many exciting things coming up. I mean, we're streaming on there right now, so follow us. We have so much coming on our YouTube channel. Subscribe. I think the girls, everyone says subscribe now. So subscribe to our YouTube channel so that you can get updates when we post new things. You can also turn on post notification. That way, when we have something like this going on, if you've not heard about it from our emails or our Instagram, you can easily just get notified that something is happening. I'm sure you won't want to miss out on this kind of conversation again. So please subscribe to us at She Leads Africa on YouTube. If you're not following us on Instagram, Facebook, Twitter, LinkedIn, everywhere we are She Leads Africa. Thank you so much, everyone, for joining. Thank you, Dr. Denise. I definitely will be following you and reading all your stuff and stalking you. No. I removed the stalking, Loki. I Loki removed the stalking, but yeah, I'll be following you. Yeah, I'll be following you. If I have a question, I can message you and be like, Dr. Denise, I'm your girl. This is what's going on.
I'd be happy to.
So yeah, she has given us the mandate to follow her, and bug her from time to time, but please let's not overdo it. So yes, thank you so much. I'm glad we got a chance to do this. I'm sorry we stayed over time. It was because the conversation was just so great. We had
it's so good. No, totally.
Yeah, we had to take some more questions. We couldn't help but do that. But if we did not address your questions, like Dr. Denise said, she has shared her Instagram. You can ask her on Instagram, or someone said they missed your handle. So can you please say it again so that
yes,
we can get it?
Yes, and I typed it in the chat here as well, but Denise, like my first name, DENISE, and then underscore, and then DDOC. So Denise
Okay,
D.
great.
Yeah.
Okay, so yes, you can find her Instagram chat box. So yeah, if you have any additional questions, you can DM her. You can also send us a DM at She Leads Africa, and we will transfer it. If you like us to be your male women, we will transfer it to Dr. Denise. So thank you everyone for joining in on YouTube. Those chatting and joining in on YouTube, those here on Zoom, it has been a wonderful time. Let us go and TGIF and then enjoy our weekends. So Dr. Denise, thank you so much. Have a wonderful weekend. We're so appreciative, and we hope to do more around sexual health and sexual conversations with you. So have a good evening, everyone. I'm going to be ending the session now. It was wonderful to have you here. So bye, everyone.
Okay, bye. Thank you.
Bye.